coming to the rhythms of the heart. Once we have picked up an abnormal rhythm, you can play that. The heart has its own electrical system, and the electrical system of the heart has a natural pacemaker that sits in the upper chamber of the heart and sends signal to the rest of the heart, telling the heart how many times to beat. Whenever there is a problem with that electrical signal is when you get a heart rhythm problem. So it can be a slow heart rhythm problem, it can be a fast heart rhythm problem, or it can be an abnormal heart rhythm problem. And so any of those slow and fast heart rhythm problem is what we call as an arrhythmia. And there are multiple different type of arrhythmias. Usually it's a fast heart rhythm problem that causes the arrhythmia. Some of these arrhythmias come from the top chambers of the heart. Some of these arrhythmias come from the bottom chambers of the heart. You might have all heard about things called atrial fibrillation. Atrial fibrillation, or AFib, is an abnormal heart rhythm that comes from the atria, which is the top chambers of the heart. It is one of the most common arrhythmias in the United States. It causes stroke, it can cause congestive heart failure, it can cause a lot of symptoms, and it happens because of these abnormal short circuits in the upper chambers or in the atria. Now, if the short circuits are in the bottom chambers, that's called ventricular tachycardia, and ventricular tachycardia can sometimes cause sudden cardiac arrest. And there's a lot of reasons why people have these abnormal rhythms. And they have shortness of breath, they can have palpitations, they can pass out, so a lot of problems that come along with it. And the biggest risk is obviously the risk of stroke with some of these arrhythmias.